are supposed to look at some bones and muscles of the upper limb, and you're starting with the X-ray of the upper limb region. Which region? The shoulder region. So shoulder joint region, X-ray. Yes, let us look at the left-sided region. So what do you see there? What I see is a bone of the upper limb, which is actually a long bone but in a horizontal direction. Long bone in a horizontal direction. Who is that? That is the clavicle bone. So clavicle bone is a long bone but in horizontal direction. Yes, and it has one more feature. Some books are telling it has no bone marrow, and it is subcutaneous throughout. So this is one long bone in horizontal disposition. Yes. And it is having no bone marrow as given by some books. Yes. And it is subcutaneous throughout means I can feel this bone subcutaneous throughout. Yes, you can. And what else? You know, the fracture of the clavicle bone is at the junction of the lateral 1/3 and the middle 1/3. Oh, the clavicle is divided into 3/3. Yes, it is actually medial 1/3 and middle 1/3 and lateral 1/3. So where is the fracture? Here. You are telling that fracture are happening. The fractures are happening at the junction of You're telling that fractures are happening at the junction of the lateral 1/3 and the middle 1/3. Yes, that is the point. You can also say the fractures are happening at the junction of lateral 1/3 and medial 2/3. So medial 2/3 and lateral 1/3. Yes, or you can say the fractures are happening at the junction of lateral 1/3 and intermediate 1/3. Lateral 1/3 and intermediate 1/3. That is also one way of telling. Also, one question came that you can see the coracoid process below, coracoid process part of the scapula bone below the clavicle bone, infraclavicular fossa. So coracoid process of the scapula bone can be seen below the clavicle bone in the infraclavicular fossa. So this is the coracoid process of scapula. Yes, and that is the acromion process of scapula, making a joint here with the clavicle, and which is called as the acromioclavicular joint. Now this acromioclavicular joint is helping us in shoulder abduction along with the sternoclavicular joint. So sternoclavicular joint as well as the acromioclavicular joint both are helping for shoulder abduction, which is elevation of humerus. You mean to say this joint which is with sternum here, sternoclavicle? Yes, there is a sternoclavicular joint and there is an acromioclavicular joint. So both of the joints are helping us in shoulder abduction. Remember that. And what else? What else you can see is this is the head of the humerus, and that is the lesser tubercle, and greater tubercle is the most lateral structure. So greater tubercle is the most lateral structure. Yes. And this is lesser tubercle. Yes. And this is the head of the humerus. Yes. These are the details which you wanted to know, and then you can proceed further. As you are proceeding further, you have to talk more about the clavicle bone. And what about that? See, clavicle bone is a peculiar bone because it has two primary centers of ossification, though it has only one shaft. It's a long bone with one shaft but two primary center of ossification. Generally, you can have only one primary center of ossification. This is an exception, a long bone with two primary center of ossification. It is peculiar. And what about the secondary center? There is one on the medial side where you have sternoclavicular joint. Yes, sternoclavicular joint. That is where you have one on the medial side. So one secondary center. Yes. Okay. Now a question has come. Tell me what is the exception. It is asking the exception. If you are asking me exception, then let me see. No marrow cavity. Yes, some books will say no marrow cavity, but Gray's Anatomy might differ there. Though generally spoken, it has no bone marrow cavity. And what about the long bone in horizontal disposition? Yes, that is correct. No problem. So what about the third choice? Third choice is definitely a problem because we have learnt that it has one secondary center of ossification, and it has 2 primary center of ossification. So 2 primary center and 1 secondary center? Yes, according to Gray's anatomy. So this is the answer. Yes, that is of course the answer. So you're telling that no metacavity? Yes, you can take that. Then you're telling long bone in horizontal disposition? Yes. Then you're telling that this is wrong. This is the answer. Yes, that is wrong, and that is the answer. Are you trying to say that choice number D is okay? Yes, I told you. Fractures are at the junction of the lateral and intermediate 1/3. You can see that in an X-ray here. But this is your answer. Keep that answer. Now, once we'll keep that answer, fine. Where is the X-ray? You see, this is the X-ray now, and you find this is the medial 2/3 of the clavicle, and that is the lateral 1/3 of the clavicle, which can also be told as lateral 1/3 of the clavicle and the junction of lateral 1/3 of clavicle and intermediate 1/3 of the clavicle. So you mean to say there is a medial 1/3, there is an intermediate 1/3, and there's a lateral 1/3 of clavicle? Yes. And this fracture is between the intermediate 1/3 and lateral 1/3. Yeah, that is what the question was giving, choice number D. So fracture is at the junction of the intermediate 1/3 and lateral 1/3. Yes, you can also say it is the fracture between medial 2/3 and lateral 1/3 of clavicle. That is also the same thing. So what about this question? It is asking from weight transmission. As it is asking weight transmission of the upper limb, it must be transmitted to the axial skeleton, to the sternum bone, and to the ribs. Why? Why it should be transmitted there? See, the weight of the upper limb must be transmitted to the axial skeleton, which is sternum bone and the ribs. But why should it be transmitted there? And what is the answer, by the way? See, when there are sports injury like fall on the outstretched hand, there is a chance that the thrust will cause multiple fractures in the upper limb. But there are no multiple fractures in the upper limb because weight is being transmitted to axial skeleton, the sternum and the ribs. You magnify this diagram and see what is happening. The thrust which came to the upper limb is being transmitted from the humerus bone to the scapular bone to the clavicle bone. And from the clavicle bone, where the thrust will go? Actually, one important ligament is helping, which is called coracoclavicular ligament. So here you have the coracoclavicular ligament, which is important for the weight transmission. Yes, this is the most important ligament for weight transmission. Okay, what are the other ligaments then? Let us see the other ligaments also, as there is a thrust on the outstretched hand that was coming to the humerus bone, and from the humerus bone it was going to scapular bone, and from the scapular bone it is going to the clavicle bone by this ligament, which is called coracoclavicular ligament, and clavicle will shift it to the ribs and sternum. How it will shift it to the ribs and sternum? Because there are joints and ligaments. So the very first ligament you have to remember in weight transmission is coracoclavicular ligament, and the other one which you have to remember is the costoclavicular ligament. What is costoclavicular ligament doing? It is transmitting weight of the clavicle to the first rib and the sternum. And what about this ligament, which is coracoacromial? Coracoacromial ligament is attaching to scapular bone at 2 points. One of the process is called as the coracoid process. The other is called as acromion process. So it is coracoacromial ligament attaching to the scapular bone at 2 points. Yeah, but is it helping for weight transmission or not? No. Why? Because for weight transmission, I should have a ligament between the humerus bone and scapular bone. I should have a ligament between scapular bone and clavicle bone. I should have a ligament between the clavicle bone and the ribs or the sternum. But the ligament must connect one bone to the next bone, to the next bone, to the next bone, and this ligament is not connecting next bone. It is attaching same bone. So it is not attaching the first bone to the next bone? No. So it is not for weight transmission? No. That is the answer? Yes. If you say coracoacromial is the answer because it is attaching to the scapula and scapula only, fine. What about this interclavicular? Interclavicular ligament is between the clavicle, but it is also attaching to sternum bone. So one bone to the next bone. So it will definitely help in weight transmission. So you mean to say I should keep this as the answer? Of course. Which is the most important for weight transmission? The most important for weight transmission is coracoclavicular ligament, and next in number, that is the costoclavicular ligament, and next in number, maybe interclavicular ligament, but which is not helping. This one, coracoacromial, is not for weight transmission. Okay, what about this question? It is asking us some wrong matching here, except. Wrong matching. So as you're talking about the wrong matching, except this is some muscles attaching to the upper end of the humerus bone. Let us see. Latissimus dorsi attaching to the floor of the bicipital groove, which is also called as intertubercular sulcus. That is the correct statement. The short of the biceps is attaching to tip of coracoid process along with the coracobrachialis muscle. That is also a correct statement. And subscapularis attaching to lesser tubercle, that is also a correct statement. You mean to say this statement is wrong? Yes. Why it is wrong? Because it is not the teres major, it is the teres minor, which is attaching to greater tubercle. If the teres major and not attaching and teres minor attaching, then where is the teres major attaching? I understand that this is the answer because it's a wrong matching, but can you tell me where the teres major attaching? Yes, I'll tell you in some diagrams now, but this is wrong matching and that is the answer. It will be attaching to medial lip of the bicipital groove, medial lip of the bicipital groove on the bone humerus. What is this medial lip of the bicipital groove on the bone humerus? What is that? Let us find out, but this is actually the answer. So we are looking at scapula bone. Now, yes, you look at scapula bone from the front view and the posterior view of the scapula bone on the right side. So, right scapula anterior and posterior view, yes. You will see this is the coracoid process of scapula, and that is projecting anterior. This is the acromion process of scapula, which is also coming anterior. And this is the angle, lateral angle of scapula, which is also called glenoid cavity. This is inferior angle of scapula, that is superior angle of scapula. You will also notice that there is a superior border of scapula, there is a lateral border of scapula, and there is a medial border of scapula. Then you will also look at the posterior view of the right scapula, and when you look at the posterior right scapula, this is a spine of scapula from the posterior view. This will be the lateral border of scapula, that is the lateral angle of scapula, which is called as glenoid cavity of scapula. Inferior angle of scapula, superior angle of scapula. Now that much you have idea, but we have to talk more about scapula. Actually, some muscles attaching. I told you there are two muscles attaching to the tip of coracoid process. So what are these two muscles attaching to tip of coracoid process? That was actually short of biceps brachii and also the coracobrachialis. So short of biceps brachii to the tip of coracoid process. There, yes. Then what is attaching to medial border of the scapula on the front side? If you are telling that medial border of scapula on the front side, then it is called as serratus anterior. It is on the anterior aspect of the scapula. And who is under the scapula? Under the scapula, the name is suggesting, under the scapula, subscapularis muscle. Under the scapula, subscapularis muscle supplied by upper lower subscapular nerve under the scapula. Okay. What else you want to know? I will look at the dorsal view of the right scapula then, and then we'll see that there are some muscles which are attaching here. Where? Lateral border of scapula, you have the teres minor and teres major. Origin. So origin of teres major minor is from the dorsal surface of scapula. Yes, you see. Teres minor and teres major take origin from the dorsal surface of the scapula, lateral border, lateral border. Then what is attaching medial border? There are some rhomboid major and rhomboid minor. So rhomboid major and rhomboid minor, yes. on the medial border. Yes. What else is attaching to medial border? That is the levator scapulae. Levator scapulae. So there is some levator scapulae medial border, and then there is rhomboid minor and rhomboid major. Yes. And what is attaching to spine of scapula? If you say spine of scapula, then you'll see that inferiorly and acromion process laterally is the deltoid, and running parallel to deltoid attachment is the other muscle, which is on the spine of scapula and acromion process, the trapezius. So trapezius is attaching to the upper border of acromion process, spine of scapula. Yes. And deltoid is attaching to lower border and acromion process of scapula. Yes, you see, spine of scapula and the lateral border of the acromion process is deltoid, and the superior border of the spine of scapula and the inner border, middle border of the acromion process is trapezius. Actually, trapezius come from above and the deltoid is coming below. So deltoid is going below, yes, and trapezius coming from above, yes. Then you will see there are some muscles which are above the spine. They are supraspinatus, and one is below the spine, infraspinatus. So above the spine, supraspinatus, below the spine, infraspinatus. Yes, these are some orientation which you needed, and then you can proceed further. As you're proceeding further, one more thing you have to remember is long head of the triceps attaching to infraglenoid tubercle. Now you are telling long head of triceps brachii. Yes. The long head of triceps brachii is attaching to the infraglenoid tubercle below the glenoid cavity. So below the glenoid cavity, we have long head of the triceps attaching there. Yes, this you have to remember. And you can proceed further now. As you see, we are looking at the bone humerus. Which sided humerus you are looking at? I'm looking at the right-sided humerus, upper end of the right humerus now. Yes, let us magnify. As you are magnifying, you still have to magnify, but just see that deltoid muscle is being inserted on the mid shaft of the humerus laterally. As the deltoid muscle is getting inserted on the mid shaft of the humerus laterally, there is a deltoid tuberosity for that. Yes, it is the deltoid tuberosity for insertion of deltoid. And then you magnify the upper end of the humerus. You will find there is a lesser tubercle where the subscapularis muscle will be attaching, and there's a greater tubercle where the sit muscle will be sitting. Sit muscle will be sitting means who are sit muscle? There will be a sit muscle, three muscles sitting, and one of them is supraspinatus. So then who is the other muscles? On the greater tubercle, the sit muscle will be sitting, and one of the three muscle is supraspinatus. And what is attaching to lesser tubercle? That is subscapularis muscle under the scapula. Okay, that is the insertion of the subscapularis muscle. Yes. And what is between the two tubercles? Between the two tubercles, we have the intertubercular sulcus, which is also called as bicipital groove, because there you have the tendon of biceps brachii, long head of biceps brachii. So long head of biceps brachii will send some tendon here. Yes, bicipital tendon in the bicipital groove. So this is between the two tubercle. That is why you are telling intertubercular sulcus. Yes, intertubercular sulcus, but it is also called bicipital groove for letting pass the tendon of the long head of biceps brachii. Then you will see there is a lady between two majors. And who is the lady? Lady is at the floor of the bicipital groove, the latissimus dorsi from the lower back. And who are the majors? There is on the medial lip of bicipital groove, which is the teres major from the posterior side, and there is the pectoralis major from the anterior side, which is on the lateral lip of bicipital groove. So there is a lady between two major. Who is the lady? That is lady from lower back. That is the latissimus dorsi attaching to the floor of the bicipital groove. And what is attaching to the medial lip? That is the teres major from the posterior side. That is the scapula. And what is attaching to the lateral lip from the anterior side? Pectoralis major. So we have to see all those details now, and you will find these are the muscles. Which muscles are you talking about? See, there's a muscle which coming from the lower back. It is the latissimus dorsi, and now see where is it coming. you magnify the diagram. As you magnify the diagram, you'll notice that this lady, which is latissimus dorsi, has come and attaching here to the floor of the bicipedal groove. If you're telling that it is attaching here to the floor of the bicipedal groove, and that is the lady, or the, I think it is having some spiral fibers. Yes, it is having some spiral fibers. Latissimus dorsi has spiral fibers, like pectoralis major has spiral fibers. So pectoralis major has spiral fibers. Yes, inferior fiber going superior. So like that, latissimus dorsi has spiral fiber, inferior fiber going superior. Yes, and attaching to the floor of the bicipedal groove, and also the other spiral muscle. There is other spiral muscle attaching. Other spiral muscle is the pectoralis major attaching to lateral lip of the bicipedal groove. Then who is attaching to medial lip of the bicipedal groove? That is a muscle coming from the lateral border of scapula, but not anteriorly. It is posteriorly, dorsal scapula. So this muscle came from the dorsal scapula. That is the teres major. Yes, I cannot see much of teres major. Yes, you cannot see because it is hidden by this muscle, the latissimus dorsi. But it will be attaching to this medial lip of the bicipedal groove. So can we see more details of this teres major attaching to medial lip of bicipedal groove then? Yeah, we will see. But remember, this is the lady between the two majors. And remember that these two muscles, that is the latissimus dorsi and the teres major, along with the muscle which is here, that is the subscapular muscle, the three muscles will be forming the posterior wall of the axilla. Which three muscles will form the posterior wall of the axilla? It is a muscle in the scapula, which is called subscapularis muscle, and the muscle of lower back, which is latissimus dorsi, and the teres major coming from the dorsal surface of the scapula. So three muscles forming the posterior wall of axilla. Yes. And which muscle form anterior wall of axilla? Anterior wall of axilla is two muscles. They are pectoralis major and pectoralis minor. So pectoralis major and pectoralis minor will form anterior wall of axilla. Two muscles will form the lateral border of the axilla. Lateral border of axilla is this humerus bone, bicipital groove. So bicipital groove and bicipital tendon is the lateral border of this axilla. Yes, lateral border of axilla is the humerus bone with the bicipital groove and the bicipital tendon. So anteriorly you have pectoralis major minor. Yes, and posteriorly you have the subscapularis and the latissimus dorsi and teres major. Yes, this you have to remember. Now as you move further, look at the humerus from the posterior side to discuss sit muscle sitting on the greater tubercle. So you have to look from the posterior side. Yes, posterior side. Sit muscle sitting on the greater tubercle. The S was seen as supraspinatus. Then you have the infraspinatus and the teres minor. But remember, maybe supraspinatus or infraspinatus or teres minor, the sit muscle sitting on the greater tubercle would have come from the dorsal aspect of the scapula. So sit muscle, one above the spine of scapula, one below the spine of scapula, one in the lateral border of the scapula. Sit muscle coming from the dorsal side of scapula and inserting on the greater tubercle there. Sit muscle sitting on greater tubercle. Now if you say so, fine. Let us look at the lower end of the humerus. And when you are looking at the lower end of the humerus, you will see there are condyles of the humerus. What about the condyles of humerus? You will see that there will be the lower end of humerus having condyles, and there is a medial condyle which is called trochlea, which is pulley shape, and lateral condyle which is a cap on the head of the radius. So it is called capitulum. Capitulum is the lateral condyle. Yes, and the trochlea is the medial condyle on the lower end of humerus. Yes, and remember they are intracapsular. When you say they are intracapsular, means the capsule of the elbow joint. Yes, capsule of the elbow joint. They are intracapsular. Let us see them. Lower end of the right humerus now. Yes, lower end of right humerus. See, this is the capsule of the elbow joint, and they are intracapsular. Who is intracapsular? The condyles of humerus. And who is the condyle of humerus? You see, this is the trochlea, which is a pulley shape, and that is the capitulum, which is caput means head. head shape, head, capitulum. So capitulum is lateral condyle, yes, and trochlea is medial condyle, yes, and both the condyles are intracapsular, yes. Also this space which is called coronoid fossa to receive the ulna bone, coronoid process of ulna, and here is the radial fossa which will receive the head of the radius during movement at elbow joint. So you are telling that radius bone is lateral bone related to the capitulum bone and the radial fossa where the radius bone will come in movement of elbow joint, yes. And then ulnar bone will be having a trochlear notch here on the trochlea and coronoid process on the coronoid fossa. Yes, but the point is trochlea and the coronoid process for ulnar bone, or the capitulum and the radial fossa for radius bone, lateral bone, they are intracapsular. They are intracapsular. Even the olecranon fossa, which is on the posterior side for the olecranon process of the ulnar bone, elbow joint. So olecranon fossa is where the olecranon process of the ulnar bone will come during movement of elbow joint. Yes, is intracapsular. So that fossa is intracapsular. This fossa is everything is intracapsular. Yes, but the epicondyles are extracapsular. Epicondyles are extracapsular. Why? Because they will be giving origin to some muscle. And which muscle will take origin from medial epicondyle? Medial epicondyle is giving you common flexor origin, the flexor muscles on the anterior forearm. And what is this lateral epicondyle giving? Lateral epicondyle will give you the common extensor origin, the posterior forearm muscle. So what will happen if there's a lateral epicondylitis? If there's a lateral epicondylitis, it is called as the tennis elbow. And what if it is the medial epicondylitis? It is due to that golfer elbow, golfer elbow. You mean to say in golfer's elbow, the common flexor origin or the origin of the anterior forearm flexor muscles compromised? Yeah, flexor muscles. And you're telling that in the tennis elbow, it is the common extensor origin or the lateral epicondyle or the extensor muscles of the posterior forearm compromised. Yes, like that you can write also. You can tell medial epicondyle is having common flexor origin and it is inflamed in the golf players, and lateral epicondyle is basically here. This is the lateral epicondyle. So lateral epicondyle is the tennis elbow problem where you have common extensor origin, but they are extracapsular. They are traction epiphyses. Who is traction epiphyses? Why they are called traction epiphyses? They are traction epiphyses. They are extracapsular. They are the epicondyle outside the capsule because muscles are outside capsule. And who is the pressure epiphyses? Pressure epiphyses is the condyles. They are intracapsular under the pressure of weight transmission. So you're telling that trochlea is pressure epiphysis and capitulum is pressure epiphysis. Yes, they are intracapsular and under the pressure of weight transmission. And then you're telling that lateral epicondyle or maybe the medial epicondyle are extracapsular and they are traction epiphysis because some muscles are putting traction pull. Yes, common extensor origin, common flexor origin. So remember, condyles are intracapsular for pressure epiphysis and epicondyles are extracapsular for traction epiphysis. Traction by the tendons of the muscle, and remember, tendons are always extracapsular. There are very few tendons which are intracapsular. For example, the long head of biceps is peculiar because tendon is going intracapsular. Otherwise, muscle must have tendons extracapsular. Here you can see the greater tubercle and lesser tubercle are traction epiphyses pulled by the muscles, and head of the humerus is intracapsular and pressure epiphysis. So head of humerus is intracapsular pressure epiphysis of pressure weight transmission. Yes. And tubercles, lesser tubercle, greater tubercle, they are the traction epiphysis pulled by some muscles, extracapsular. Yes, that is the point. Okay, then there is a question asking the nerves related to the humerus bone. You see, as the nerves are coming, the ulnar nerve is running on the ulnar side and passing behind the medial epicondyle and then keep running towards the ulnar bone. Medial side of the hand also. On the other hand, if you see, this is the radial nerve, which is going behind the humerus bone in the radial groove and keep running towards the radial bone, the lateral bone. And what about the relation to the epicondyle? Actually, radial nerve is coming anterior to the lateral epicondyle. If you say radial nerve is coming anterior to the lateral epicondyle, then I think the ulnar nerve is behind the medial epicondyle. Yes, ulnar nerve is behind the medial epicondyle and radial nerve is in front of the lateral epicondyle. Now, the point is that there are some nerves related to the humerus. Which nerve is related to the cervical neck of humerus? The nerve which is related to the cervical neck of humerus is this. That is the axillary nerve. So, you are telling that there is some axillary nerve related to the cervical neck of humerus? Yes, if there is a fractured cervical neck of humerus, axillary nerve is gone. And what if there is a fractured mid-shaft humerus? Fractured mid-shaft humerus, then radial nerve is gone. And what if there is a fractured medial epicondyle? If there is a fractured medial epicondyle, behind the medial epicondyle, you have the ulnar nerve, it's compromised. So, axillary nerve at the cervical neck? Yes. And radial nerve at the mid-shaft humerus? Yes. And ulnar nerve behind the medial epicondyle? Yes. And radial nerve in front of lateral epicondyle? Yes. And one more, median nerve in the midline. Median nerve in the midline. So, you are telling that there is some median nerve in the midline here at the lower end of the humerus? Yes, it is there. Okay. If you say so, now we have to look at the muscles of the anterior appendicular skeleton, which is attaching to axial skeleton. So, appendicular skeleton, axial skeleton muscles, who are they? Anteriorly. Let us look at them. They will be here. This is axial area, the ribs and sternum, and that is the appendicular area, which is the upper limb bones like humerus bone, scapular bone. So, what are the muscles? Axio-appendicular muscles. See, this is pectoralis major coming from axial area to the appendicular area. Like how? You will see it's a large muscle and it is having some spiral fibers also and taking origin from the anterior sternum, anterior clavicle and anterior ribs, costal cartilage also. That's the origin. Insertion, you know, it is the lateral lip of the bicipital groove. Let us look at the muscle now. Pectoralis major, yes. So, you're telling that pectoralis major has multiple origin, a wide origin. Yes, you see the wide origin. It is taking origin from the anterior surface of the clavicle, anterior surface of the clavicle and anterior surface of the sternum and also the anterior surface of the ribs and costal cartilage. And what is the insertion? It's a wide origin and convergent muscle. Convergent muscle. It is converging on the lateral lip of the bicipital groove here. So, lateral lip of the bicipital groove, and also one thing. See, inferior fibers are going to attach superior. Inferior fibers are going to attach superior, and the superior fibers are going to attach inferior. So, superior fibers are coming inferior. Yes. You mean to say spiral, 180-degree spiral? Yes, 180-degree spiral, because whatever was the origin, upper fibers will insert lower area and lower fibers will insert in the upper area. So, 180-degree spiral. This is a spiral muscle. Like even latissimus dorsi is a spiral muscle, and it is a convergent muscle also. So, this muscle is a spiral muscle. And it is also convergent muscle. Yes, because it is converging, a wide origin converging on a narrow insertion. And what is it doing? What it is doing, you see it is passing anterior to the shoulder joint. So, it will cause, pull the femur towards the axial skeleton. So, this muscle is pulling the femur towards the axial skeleton, means shoulder flexion. Yes, folding the shoulder, shoulder flexion. It can also pull the femur inside. So, if you pull the femur inside, you mean to say medial rotation. Yes, medial rotation. It is doing medial rotation and flexion. Yes, remember one simple rule. Any muscle which crosses the shoulder joint anterior Any muscle which will cross the shoulder joint anterior will cause flexion by pulling the humerus inside, and will cause medial rotation by pulling the humerus inside. So flexion and medial rotation, yes, like you can also tell anterior fibers of deltoid. So anterior fibers of deltoid are working along with the pectoralis major, yes, for flexion and medial rotation. It is the lateral fibers of deltoid which are abductors. So lateral fibers are abductors, yes, and anterior fibers of deltoid are flexor and medial rotators. Yes, that's what, folding, flexion. Okay, so this is the muscle. This is what you are telling, that there is some spiral fibers, upper fibers coming below. Yes, that is the point. And then you are telling that lower fibers are going above. Yes, that is the point. Twisting fibers. Fibers are twisted. Okay, then what about the... See, this question also came this year. This present year, this was the question. And it was asking about spiral muscle, pectoralis major. Now you will see that there is serratus anterior muscle which we have to talk about, and it is taking origin from the upper 8 ribs, lateral surface. If you tell that serratus anterior take origin from the upper 8 rib, the lateral surface, then where is the insertion? Insertion, it will go posterior and insert on the scapular bone. Insert the scapular bone so that it can pull the scapular bone anterior. So pulling the scapular bone anterior, you mean to say protraction? Yes, protraction. See, serratus anterior muscle now, taking origin from the upper 8 ribs. So taking origin from upper 8 ribs, the anterior lateral surface, yes, anterior lateral surface, and inserting on the scapular bone posteriorly. Where? On the medial border of the scapula. So medial border of scapula, not the lateral border. No, not the lateral border, medial border. And also anterior surface, not the dorsal scapula. It is not the dorsal scapula. It is not the dorsal scapula. It is ventral scapula, anterior surface of scapula. Serratus anterior, anterior surface of scapula, ventral surface of scapula. And what is this muscle doing? You see, what is it doing? It will pull the scapula anterior. It is called as protraction. So it is the serratus anterior pulling the scapula anterior, protraction. Yes, like you push the wall. Push the wall. Serratus anterior is doing protraction. Okay. You are pushing the wall now. Yes, you see. This is protraction, and it is done by the serratus anterior. If you are telling that the serratus anterior, it is working with some pectoralis minor there, yeah, maybe, but you remember that if you pull the scapula forward to push the wall, then it is serratus anterior working, pulling the scapula forward. And how do I do retraction? You take the scapula back by the dorsal scapular muscles. Name, you have this rhomboid muscles and trapezius muscle of the upper back. So trapezius is muscle of upper back, yes, and rhomboid on the scapular bone, pulling it back, yes, protraction and retraction, protraction and retraction. Okay, fine. What is happening here? You have asked one person to push the wall, and what happened? See what happened. What is this? It is the medial border of the right scapula becoming prominent. Why the medial border of the right scapula becoming prominent? Because serratus anterior is paralyzed and it is not able to pull the scapula forward. It was attaching to medial border of scapula anteriorly. It is supposed to pull, and if it is not pulling, then it is called winging of scapula. If it is not pulling, the medial border of scapula become prominent, and when the medial border of scapula become prominent, it is called as winging of scapula, paralysis of serratus anterior muscle. Could be injury to long thoracic nerve given by directly from the roots of C5, 6, 7 in the neck region. You remember? Now we have to look at some posterior axio-appendicular muscles, means axial skeleton, appendicular skeleton, yes, and you can see that from the dorsal side. This is trapezius muscle, which is a triangular muscle, and you can discuss that now. What is trapezius muscle doing? You see, this is the trapezius muscle, which is muscle of the upper back, and it is triangular. Trapezius muscle is triangular, yes. Okay, then what is it doing? See, the origin of trapezius muscle is the vertebra and the occipital bone. Occipital bone, like that, yes. Upper back, yes. And the vertebra, yes. That is the origin. Then where is the insertion? Insertion, I told you. Spinoschapula, acromion process of scapula, and also clavicle bone. What is that? Where is the insertion? Insertion is to the upper border of the spine of scapula, middle border of the acromion process, and posterior border of the clavicle. It is J shape. J shape. J shape insertion. Yes. What is J shape insertion? Let us see. This is the muscle. So this is the trapezius muscle, muscle of upper back. Yes, muscle of upper back. You see here. Where is it coming from and where is it inserting? See, this muscle, the origin is occipital bone and the vertebra. Okay, then where is the insertion? Insertion is J shape. Yeah, insertion is J shape, but where? It is the upper border of the spine of scapula and inner border of the acromion process and posterior border of the clavicle bone. Posterior border of the clavicle bone. Yes. Okay. Posterior border of clavicle bone, medial border of acromion process, upper border of spine of scapula. What is it doing? What do you think? This is the insertion. It will pull the scapula upwards, shrugging of shoulder. So pull the scapula upwards, shrugging of shoulder. What else it will do? You see, you remember, serratus will pull it anterior and trapezius will pull it posterior. Retraction. So trapezius for retraction. Yes. And serratus anterior for protraction of scapula. Yes. Okay. That is what it is doing. Fine. What about the latissimus dorsi, the lady from lower back? Latissimus dorsi, which is the lady from lower back, is coming from the lower thoracolumbar fascia. Thoracolumbar fascia. And it is taking origin from the hip bone also. Iliac crest of the hip bone. Iliac crest of the hip bone. Yes. Okay. Vertebra, lower vertebra bone, yes, lower vertebra, and iliac crest of the hip bone, and thoracolumbar fascia, and insertion is lady between two majors, lady between two majors. You mean to say floor of the biceps groove? Yes, floor of the biceps groove, you remember? So you are talking about the muscle of lower back now. Yes, this is the muscle of lower back, and it is called as latissimus dorsi, and it is going to insert on the humerus bone. So, where is it originating from? From the lower vertebra and the hip bone. Hip bone, you mean to say here, iliac crest of hip bone? Yes, iliac crest of hip bone. Let me show you the details now. It is also taking origin from the inferior angle of scapula. Inferior angle of scapula here? Yes, inferior angle of scapula, origin. Insertion is convergent fiber again. Large region converging in a single insertion. Spiral fibers also, spiral. Inferior fiber becomes superior. This is again the same diagram, I believe. Yes, but it is for the muscle of lower back, that is latissimus dorsi. So muscle of lower back, the latissimus dorsi. What is the origin? You see, the origin is here. Where? See? This is the lower vertebra origin, and also the iliac crest of the hip bone and thoracolumbar fascia, and also inferior angle of scapula. So this much of origin. Yes, you see, there is inferior angle of scapula and the lower vertebra and the thoracolumbar fascia and also the iliac crest of the hip bone, and insertion is small, convergent fiber like pectoralis major, spiral fiber, inferior fiber becoming superior, and vice versa. So this is what is spiral now. Yes, you see, lower fiber become upper fibers, and insert where? Insert where? You don't know, lady between two majors. This is the lady between two majors. It is the floor of the bicipital groove, but on the anterior side of the humerus, not posterior. Anterior aspect of the humerus, not posterior. So that is the insertion. What is this muscle doing? What is this muscle doing? It will help you to scratch the back. What is that? Scratch the back. Scratch the back. Scratch the back means scratch the back like this. Yes. Okay. It will pull the humerus bone like this to the back. Yeah, that's what. See, origin is fixed. Insertion is moving. Who is insertion? Humerus. So humerus's insertion is moving, is pulling the insertion towards the origin. Yes, I think it is then doing no lateral rotation but medial rotation. Yes, medial rotation. And it is not doing abduction but ADD adduction. Yes, adduction. And it is not doing folding of the shoulder joint but no flexion but extension. Yes, extension. It is doing extension. The three activities of latissimus dorsi are to scratch the back. What is that? It is not doing lateral rotation. It is doing medial rotation. And it is not doing abduction. It is doing adduction. And it is not doing flexion. It is doing extension. So extension and internal rotation and adduction to scratch the back. Yes, that is the job. Okay, what about the levator scapula and rhomboid muscle? Levator scapula and rhomboid muscle all attached to the scapula bone. Medial border. Medial border, yes. Okay, medial border. What is the origin? Origin is, of course, the vertebra bone. If you say vertebra bone, cervical vertebra, yes, cervical vertebra. And insertion is the middle border of scapula, superior angle of scapula, elevate the scapula. That's why elevator scapula name. Elevate the scapula, yes, elevate the scapula, yes. And then you have the rhomboid major, minor. So this is rhomboid minor, this is rhomboid major, and they are inserting on the dorsal surface of the scapula, medial border of the scapula, pulling the medial border now. See, the origin is fixed, means the vertebra, and insertion is moving. Who is that? Scapula bone. And what are they doing? See, serratus was doing protraction, and now they are doing retraction, bringing them back. Pull the scapula back towards the midline. If you want to pull the scapula back towards the midline, this is protraction. Pull the scapula back to the midline is that by back muscle, rhomboid major and minor, along with trapezius muscle. And remember, levator scapula work with trapezius for shoulder shrugging. If you want to shrug the shoulder, levator scapulae, elevator scapulae with trapezius muscle. Trapezius is for elevation and also for retraction. Okay, fine. Now what? Look at the deltoid muscle. It is a multipinnate muscle. Means it has multiple tendinous intersections because it is having some anterior fibers, lateral fibers, and posterior fibers. Remember, anterior fibers of deltoid are flexors and medial rotator, and posterior fiber will be exactly opposite. You mean to say extensor and lateral rotator? Yes, that will be posterior fibers. Then what is the middle fibers? Middle fibers are powerful abductor shoulder joint. Powerful abductor shoulder joint. So you're talking about deltoid muscle now? Yes, and you see here, the deltoid muscle is having posterior fibers which are working exactly opposite to that the anterior fibers. So if anterior fibers are flexors, the posterior extensor. If anterior fibers are medial rotator, then posterior fibers will be lateral rotator. Whereas the middle fibers are powerful abductors. They will abduct the humerus, shoulder joint. What is the insertion? Insertion is on the deltoid tuberosity, on the humerus bone. If you say insertion is V-shaped insertion on the deltoid tuberosity of the bone humerus, what is the origin? Origin is J-shape. J-shape like trapezius. Yes, J-shape like trapezius. So if you say the origin is J-shape like trapezius, like this, yes, like that. Means you are telling spine of scapula and acromion process of scapula and clavicle bone. Yes, clavicle bone anteriorly, laterally is acromion process, and posteriorly is the spine of scapula. That is the insertion of the trapezius muscle and origin of the deltoid muscle. But there is a difference, you know. Inner J is for trapezius and outer J is for deltoid. So outer J is for deltoid, yes, and inner J is for trapezius, yes. Let us look at the deltoid now. You are telling that it is some J-shape origin. Yes, this is a J-shape origin, and this is the V-shape insertion on the mid shaft of the humerus, deltoid tuberosity. So this is the mid shaft of the humerus, deltoid tuberosity. Yes, mid shaft of the humerus, deltoid tuberosity. That is the insertion, but this is the, now see, it is the lower spine of scapula, lower border spine of scapula, and outer border of the acromion process, and the anterior border of the clavicle. So it is the anterior border of the clavicle, yes. Lateral border of the acromion process, yes. And the inferior border of the spine of the scapula, yes. What was the trapezius like? Trapezius was on the inner side. Upper border of the spine of scapula, inner border of the acromion process, posterior border of the clavicle. That is also J shape, but there is inner J for insertion of trapezius. So you're telling that there is some lateral fibers which are abductors, and there are anterior fibers which are flexor and medial rotators, shoulder joint, and posterior fibers which are extensor and the lateral rotator, shoulder joint. Yes, that is what. It is supplied by axillary nerve. You remember where it came from? The axillary nerve, I think stars. Yes, stars, right. So can you tell me the other details of axillary nerve? You remember the details of axillary nerve? Let us see the diagram and then you will see the details. See, this is the axillary nerve. Where is it coming from? Stars, posterior cordobrachial plexus. And where is it going? To the axilla and quadrangular space and surgical neck of the humerus, if you remember. See, this is the deltoid muscle and this is teres minor. Yeah, okay. Teres minor is a lateral rotator and deltoid is a powerful abductor. Okay. Abductor and lateral rotator supplied by axillary nerve. Yes, that is axillary nerve. So this is axillary nerve. Yes. And axillary nerve is now coming from the posterior cord of the brachial plexus. Yes, you see here is a posterior cord of brachial plexus. So this is the posterior cord of brachial plexus which is giving axillary nerve, and axillary nerve is now giving supply to the deltoid and teres minor. What else it is doing? You remember regimental batch area? Regimental batch area, skin on the lower part of the deltoid. Lower or upper? Upper part of the deltoid. Skin on the upper part of deltoid. That is supplied by the axillary nerve. It is giving cutaneous branch. Cutaneous branch. Okay, so this is about the axillary nerve here. Yes, supplying deltoid and teres minor. Right, then this is the detail you wanted to know. Yeah, I have already told you. It is axillary nerve supplying deltoid teres minor and abduct the shoulder from 15 to, it is actually 15, beyond 15 degree. It is doing. So abduction of shoulder beyond 15 degree. Who is that? Deltoid muscle. And who is doing the first 15 degree? First 15 degree is basically by supraspinatus. So first 15 degree supraspinatus, and after 15 degree mainly the deltoid. Yes, deltoid. Lateral fibers, powerful abductors, and it is also helping in lateral rotation of shoulder. Yeah, if posterior fibers are involved, posterior fibers are lateral rotators. Okay. Axillary nerve supplying deltoid muscle. Yes, that is what. And this is the area you were talking about, the regimental batch area. Yes, regimental batch area, C5 dermatome. C5 dermatome. Axillary nerve. Okay, what about the supraspinatus, infraspinatus, and sit muscle? That sit muscle you talking about? Yes, sit muscle. Let us talk about sit muscle now. You have to look at the dorsal view of right scapula. And when we are looking at the dorsal view of the right scapula, you will see that is the sit muscle. This is above the spine, supraspinatus. And that is below the spine, that is infraspinatus. And that is the lateral border of scapula, the teres minor. So lateral border of scapula, teres minor. Sit muscle, where are they sitting? On the greater tubercle, greater tubercle, greater tubercle of humerus. So sit muscle sitting on greater tubercle of humerus. Yes, they contribute to what is called as the rotator cuff, posterior-superiorly. Posterior-superiorly. So they are contributing posterior-superiorly what is called as the rotator cuff to stabilize the shoulder joint. Yes, stabilize the shoulder joint. Origin Origin is scapular bone. Insertion is the humerus bone. And what are they doing? See, the rule is very simple. If the muscles are crossing the joint from the posterior side, then they will be rotating the humerus outside. Means lateral rotators. Yes, lateral rotators. They are lateral rotators. And what about the supraspinatus, which is going from superior side? Because supraspinatus is going from superior side, it will pull the humerus superior. You mean to say initiate the abduction? Yes, supraspinatus will initiate the abduction, whereas the dorsal muscles, they cross the joint posteriorly, so they'll pull the femur posterior. What will happen when you pull the femur posterior? This is not femur, this is humerus. So they'll pull the humerus posterior. Because this rule is valid, and it is pulling the humerus posterior, which is, lateral also. So lateral rotation of the shoulder joint? Yes. Okay. What about the subscapularis, which is under the scapula? If you want to see that, you have to look from the front view. You have to look from the front view, subscapularis. And see here, this is the muscle under scapula, which is subscapularis muscle. From the front view, anterior surface of the scapula and inserting on the lesser tubercle. If it is inserting on the lesser tubercle, then it is also contributing to the rotator cuff. As it is contributing to rotator cuff, it is considered as forgotten muscle. Why it is considered as forgotten muscle? Because it is usually missing from literature. When you read literature, they do not mention the rotator cuff muscle, which is called as subscapularis muscle. Means the sit muscle are given, but not the subscapularis given. Yes. So subscapularis muscle is often omitted, not mentioned under the rotator cuff. Yes, then you are asking, why are you not considering subscapularis muscle as a component of rotator cuff? Have you forgotten? And yes, they have forgotten. It is a forgotten muscle, normally missing from the literature of the rotator cuff, though it is obviously a component of a rotator cuff there. See, rotator cuff is posterior, superior, and anteriorly stabilizing the shoulder joint. So you are telling that there is a stabilizer factor for the shoulder joint, and there is posteriorly present and superiorly present and anteriorly present. Yes, but inferiorly it is deficient, so inferior dislocations are more common. So shoulder joint is being stabilized by some musculotendinous rotator cuff. Yes, it is musculotendinous rotator cuff, and it is strong posteriorly, superiorly, anteriorly, but deficient inferiorly. So inferior dislocation of the shoulder joint are more common. Actually, anterior-inferior. Why anterior-inferior? Because anteriorly you have only one muscle. And who is that? That is the subscapularis. So you are telling that anteriorly there is only one muscle, subscapularis. So anteriorly it is weak rotator cuff fibers. Yes. And inferiorly it is deficient. Yes. That's why dislocations are anterior and inferior. Yes. Because posterior superiorly they are strong fibers of rotator cuff. And what are the muscles? They are called sits muscle. Sits muscle. Sits muscle. Who is the sits muscle? Who is the superior muscle? Supraspinatus. And then what do you have? I have the infraspinatus. And then what do you have? Teres minor. So you're telling this is teres minor coming from the lateral part of scapula? Yes. And that is the infraspinatus coming from the dorsal scapula? Yes. And then there's a supraspinatus here? Yes, you see there is supraspinatus, infraspinatus, and teres minor coming from the dorsal scapula. And then on the ventral scapula, you have subscapularis. They are called sits muscle. And sit muscle sit on the greater tubercle, whereas the subscapularis sitting on the lesser tubercle. Let me give you one more diagram for the same. And it is here. You are telling that there is this supraspinatus over the spinal scapula, yes, sitting on the greater tubercle, and then there is this infraspinatus muscle below the spinal scapula, yes, inserting on the greater tubercle, and then you are telling that there is this teres minor coming from the lateral part of scapula, inserting on the greater tubercle, yes. Sit muscle sitting on greater tubercle. And then you are telling there is some muscle which is on the anterior side of the scapula and coming to the lesser tubercle anteriorly. Yes. That is subscapularis muscle under scapula, anteriorly inserting on the lesser tubercle. And these four muscles make the rotator cuff. Yes, these four muscles make the rotator cuff. You see here, sit muscles sit on the greater tubercle. S for supraspinatus, I for infraspinatus, and T for teres minor. This is greater tubercle. And the other S, which is subscapularis muscle, which is the forgotten muscle of rotator cuff, is sitting on the lesser tubercle anteriorly. The rotator cuff is strong posterior superiorly but weak anteriorly because only one muscle there, and deficient inferiorly. Rotator cuff muscles, sits muscle. So what about the teres major? Teres major is coming from dorsal scapula, lateral border dorsal scapula, lady between two major. This is one of the major. You remember the major? So it is coming from dorsal scapula. Yes, you see. Lateral border of the scapula. Yes. Where is the insertion? Medial lip of the bicipital groove, anteriorly on humerus. So it is teres major now. Yes. Dorsal scapula, lateral border of scapula. Yes, origin. Insertion is medial lip of the bicipital groove on the anterior humerus. Yes, that is what. It is forming posterior wall of axilla. You remember? Posterior wall of axilla. Teres major is posterior wall of axilla, and pectoralis major is anterior wall of axilla. And let us discuss the details, their activities. You mean to say, whichever muscles we have discussed their activities now? Yes, actions of those muscles, you see. And what are the actions? You have to look at the dorsal view of the right scapula now. Dorsal view of the right scapula and revise the actions, because you have already discussed the actions, you have to revise them. See, there are some muscles which are elevating the scapula. Who is elevating the scapula? That is a muscle, its name is elevator scapula. And upper fibers of trapezius, upper fibers, so that is why shrugging of shoulder. So levator scapula and the trapezius, yes. Even the rhomboids, they have one vector which can pull the scapula up. So rhomboid with the levator scapula causing shrugging of shoulder, yes, but majorly trapezius held by levator scapula. Then you can say rhomboid. Okay, then who is depressing? If you say depressor of the scapula, then you had lower fiber of trapezius. Oh, trapezius is a depressor of shoulder. Okay, shrugging means going up, down. Yes, that is what? Up or down. So trapezius will be a depressor also, along with serratus. Why serratus? You remember serratus? Inserted to inferior angle? Inferior angle. It is a depressor also. Oh, serratus is a depressor also. Yes, it is. Okay, then who is helping me in shoulder abduction? Actually, shoulder abduction, if you say, there are a lot of muscles working, you have told. Initiation of abduction, supraspinatus, and then which muscle working? The lateral fibers of deltoid. Then there is an overhead abduction. And if you want the overhead abduction, then you have to use two muscles. One is serratus anterior and one is the trapezius to comb your hair. If you want to comb your hair, then you have to use overhead abduction. And what is happening now? You have to elevate the humerus, which is abduction, but you have to rotate the scapula also. Where? Laterally. So who is rotating the scapula laterally? It is the serratus and trapezius together. So serratus and trapezius, yes, trapezius the superior part and serratus, they are rotating the scapula. Where is the scapula rotating? Lateral rotation of scapula. Lateral rotation. You see, this is called lateral rotation of scapula, which is done by serratus anterior and trapezius muscle for the shoulder abduction, which is overhead abduction. Okay, then we will do the medial rotation. Whoever is the retractor muscle, and who is the retractor muscle? You remember medial border of scapula, some muscle attaching? Rhomboid and levators. Rhomboid and the levator. But remember, levator is basically an elevator. If you have to choose, rhomboid is first answer for medial rotation, because levator is basically for elevation. Okay, you are telling that protractor was the pectoralis minor and serratus? Yes, protractor. The retractor are the dorsal muscle, which are the trapezius and rhomboid muscles. They are retractor. So this already we have discussed. It was just a revision, in fact. Okay, then let us. Okay, then let us draw one diagram discussing the origin insertion of various muscle. Here you have to look at the anterior view of the right humerus, and there you will show this is the bicipital groove, and then you will also tell there's a lateral lip of bicipital groove and medial lip of bicipital groove. So there's a lateral lip of bicipital groove, and this is the medial lip of bicipital groove. Yes, and then there is a floor of the bicipital groove, lady between two majors. This is what you have to discuss. Also, you will tell that there is a greater tubercle of humerus, and then there's a lesser tubercle of the humerus. So greater tubercle, lesser tubercle of humerus, then you will tell that there is some intertubercular sulcus also. Yes, there is some intertubercular sulcus, and this is the floor of intertubercular sulcus. The floor of intertubercular sulcus, or you can say floor of bicipital groove also. Floor of bicipital groove also you can say. Okay, then what else? You have to draw the scapula also, front view of the right scapula. If you say it is the front view of the right scapula, then this must be the glenoid cavity there. Yes, that is the glenoid cavity. And this is the lateral border of scapula. Yes. And this is the medial border of scapula. Right. So this is front view of the right scapula, and this is the medial border of scapula, and this is the lateral border of scapula. This is the glenoid cavity of the scapula. Yes. And then you can also show the sternum bone and the ribs. So this is the sternum bone and the ribs here. Yes, the ribs attaching to sternum bone. Now, once you have shown the front view of the sternum and the front view of the ribs there, and also you have shown the front view of the right scapula and front view of the right humerus, now you can discuss the muscles, origin insertion. You can tell clavicle bone also. This is the clavicle bone here. So that is the clavicle bone. Yes, that is the clavicle bone here. Now, you will see there are some fibers which are coming from the anterior surface of clavicle and from the anterior surface of sternum and from the anterior surface of the ribs, and they are pectoralis major. So pectoralis major take origin from anterior surface of clavicle, anterior surface of the sternum, anterior surface of the ribs, costal cartilage, yes, and insert into the lateral lip of the bicipital groove. That is pectoralis major insertion. You will say that is the pectoralis major insertion. Fine. What about the teres major? Teres major, if you say, then I'll tell that it came from the dorsal aspect of the lateral border of scapula, dorsal aspect of the lateral border of scapula, and insert here. So that is the origin insertion of the teres major. Yes, it is inserting to the medial lip of the bicipital groove. So teres major is coming from the dorsal surface of the scapula on the lateral angle of scapula, lateral border of scapula, and inserting on the medial lip of the bicipital groove. It is forming posterior wall of axilla. This will form the posterior wall of axilla, and pectoralis major form anterior wall of axilla. Pectoralis major come like this, forming anterior wall of axilla, and teres major come from posterior side, forming posterior wall of axilla. Who else is forming the posterior wall of axilla? Actually, there's a muscle from the lower back, and that muscle which came from the lower back, the latissimus dorsi, is having a spiral fibers and inserting here at the floor of the bicipital groove. So you are telling that this latissimus dorsi coming from the lower back is going to insert into the floor of the bicipital groove. There are spiral fibers. Yes. Is also contributing to the posterior wall of axilla. Yes, also contributing to the posterior wall of axilla along with one more muscle, and that muscle is under the scapula. If you say that muscle is under scapula, are you talking about the subscapularis muscle anteriorly? Yes, inserting on the lesser tubercle here. So you are talking about the subscapularis muscle now, which is under the scapula anteriorly. Yes, it is subscapularis muscle which is on the ventral surface or anterior surface of the scapula, inserting on the lesser tubercle. So there are three muscles, posterior wall of axilla, and they are subscapularis and the teres major and the latissimus dorsi. Whereas anterior wall, there are two muscles, pectoralis major, and under cover of that will be pectoralis minor also. So pectoralis major and minor, anterior wall of axilla there. And what is in the lateral wall of axilla? It is a tendon which is passing here, the Long head of the bicep femoris, which is in the bicipital groove. So long head of the biceps brachii. Yes, biceps brachii. So you're telling it is the long head of biceps brachii, which is in the bicipital groove. Yes. And in the intertubercle sulcus, yeah, it is intertubercle sulcus. And it is the lateral wall of the axilla, yes, with the humerus bone. Then who is the medial wall of axilla? Medial wall of axilla will be the upper four ribs, giving origin to, it is upper four ribs giving origin to serratus anterior muscle. Actually, it is upper eight ribs giving origin to serratus anterior. Okay, so can we see the serratus anterior now? Yeah, you can see some ribs were there. These are the ribs, and these ribs are attaching to sternum, and those ribs which are attaching to sternum, they will be giving the origin of the serratus. Where is the insertion? If you remember, we have discussed that the origin is from the ribs and insertion is on the medial border of the scapula anteriorly, costal surface anteriorly. So that is the origin insertion of the serratus anterior muscle. Yes, serratus anterior muscle, origin insertion. Understand? Serratus anterior muscle take origin from the lateral anterolateral surface of the upper eight ribs and inserting on the medial border of the scapula. When it is inserting on the medial border of the scapula, dorsally or ventrally? No, not ventral, it is dorsal. It is ventrally, it is attaching. So you're telling that this is the serratus anterior muscle, which is attaching to the anterior or ventral surface of the medial border of scapula there. Yes, it can pull the scapula anterior and is for protraction of the scapula. So this is what we wanted to know. Yes. What is attaching to greater tubercle? Attaching to greater tubercle is the set muscle, which can be seen better from the posterior side. So can we see the posterior side now? Yes, you have to see from the posterior side now. Supraspinatus attaching to greater tubercle. So this is the dorsal view of the right scapula. Yes, dorsal view of right scapula showing you some quadrangular space and some lower triangular space. Also, we have to see what is passing in lower triangular space and what is passing in the quadrangular space. What are the boundaries also? You can see now. This is dorsal view of the right scapula. This is the spine of the scapula, and you see one muscle coming from lateral border of scapula, which is teres minor, and the other coming from lateral border of scapula is the teres major. If you remember, teres minor is taking origin from the lateral border of scapula and inserting on the greater tubercle of the bone humerus, whereas the teres major is taking origin from the lateral border of scapula, inserting on the medial lip of the bicipital groove. They'll form the boundaries for the quadrangular space, and then there is one more muscle related. Which one? This is the long head of the triceps muscle, and long head of the triceps muscle, if you remember, we have discussed long head of the triceps muscle coming from infraglenoid tubercle, giving origin to the long head of the triceps, and it is also forming some boundary for the quadrangular space. There is also the surgical neck of the humerus bone, quadrangular space. Then what is the content? Content is one nerve, which is the axillary nerve you have known earlier, and an artery which is going behind the humerus in a circumferential manner. So posterior circumflex humeral artery, branch of the axillary artery. Then what are the boundaries of the lower triangular space? If you want to see the boundary of the lower triangular space, you can see it is the shaft of the humerus and the teres major muscle here. If you say it is the teres major muscle, it is long head of triceps also. Yes, long head of triceps. So there's a long head of triceps, there's a teres major, shaft of the humerus. And what are the structure passing through? The structure passing through, you can see, is a nerve and one artery. So what is this nerve and artery? Actually, it's a radial nerve going into radial groove, and along with that, the deep artery of the arm, which is called profunda brachial artery also. So this is the diagram which we are supposed to draw now. Let's draw the diagram. You are looking at the dorsal view of the right humerus bone now. Dorsal view of the right humerus bone, and this is the head of the humerus from the posterior view, right humerus, and then you can say that this is the glenoid cavity of the right scapula. This is lateral border of the scapula, superior border of scapula, and medial border of scapula seen from the dorsal side. This is the spine of scapula. So that is the spine of scapula. Yes, I think there's a muscle above the spine of scapula. Yeah, supraspinatus, and muscle below the spine of scapula. Yes, infraspinatus. I think there's a muscle attaching to the infraglenoid tubercle. Yes, that is a muscle, infraglenoid tubercle, and you are calling it as the long head of the triceps, and that long head of the triceps is going to insert on the ulnar bone inferiorly, but the origin of the long head of triceps is infraglenoid tubercle. Supraspinatus over the spine of scapula, infraspinatus below the spine of scapula. Then where is the teres minor? Teres minor, if you want to know, then this is the teres minor on the lateral border of the scapula and on the dorsal. This is all dorsal muscles. Remember, this is all dorsal muscles. So you are looking at the dorsal muscles of the scapula. Yes. And this is the teres minor now. Yes, that is the teres minor attaching to the dorsal surface of the scapula on the lateral border of scapula. Where is the insertion? Insertion, if you ask me, then I'll tell you, these are the sit muscles sitting on the greater tubercle. If you say sit muscle sitting on the greater tubercle, then who are they? See, this is supraspinatus muscle, this is infraspinatus muscle, and that is the teres minor muscle. So you are showing the teres minor muscle now? Yes, that is the teres minor muscle. So this is the teres minor muscle, which is origin insertion. Yes, it is origin and insertion. See, the sit muscle sitting on the greater tubercle, and what is this S for? That is supraspinatus muscle, which is the initiator of the shoulder abduction. And what is below the spine of scapula? Infraspinatus muscle, which is also inserting here. And this is the teres minor. Yes. Then what about the teres major? If you want to see the teres major, then it is here on the dorsal aspect of the scapula lateral border, that is origin, and insertion, if you remember, is on the, tell me, medial lip of the bicipital groove, but on the anterior side of the humerus. So this is the teres major. Yes, it is the teres major inserting on the medial lip of the bicipital groove, but on the anterior side of the humerus. That is teres major. So this is teres major. Yes. And it is also on the dorsal scapula. Yes, it is on the dorsal scapula and lateral border of scapula. Insertion is on the anterior aspect of the humerus bone. Okay, then I think this is the quadrangular space. Yes, that is the quadrangular space, and you can mark the boundaries. Tell me the boundaries of quadrangular space. As you are marking the boundaries of the quadrangular space, you can see this is the quadrangular space. What is the superior boundary? That is, I think, the teres minor. Yes, teres minor. What is the inferior boundary? I think that is the teres major. Yes, that is teres major. And what is the medial boundary? Medial boundary, I think, long head of the triceps. Medial boundary? Yes, medial boundary. What is the lateral boundary? Lateral boundary is the bone humerus, and it is the surgical neck of humerus. Yes, this is the surgical neck of the humerus there. So tell the boundaries again. There's a surgical neck of humerus, there's a teres minor superiorly, teres major inferiorly, and long of triceps medially, and the contents are one nerve and one artery. So which nerve and which artery? I will write 1 and 2. What is this 1 and 2? One is the axillary nerve going to the surgical neck of humerus, and the other is this. What is this? Posterior circumflex humeral artery. So posterior circumflex humeral artery, yes, following the axillary nerve, and they are in the quadrangular space, and then both of them will go here. Where? To the surgical neck of the humerus. Then what are the structures in the lower triangular space? If you want to discuss lower triangular space, then you have to talk about the shaft of the humerus. shaft of humerus. What is this shaft of humerus having? It is having a groove here, and that is called as the bicipital groove. This is called as the radial groove. So this is the radial groove where the radial nerve is passing. Yes, radial groove is in the mid shaft of the humerus posteriorly. So this is the radial groove which is in the mid shaft of the humerus posteriorly, and that is where the radial nerve is passing posterior to the humerus bone. Yes, that is the point. Okay, so where is the radial nerve coming? From the lower triangular space. Tell me the boundaries. Boundaries of lower triangular space. I think this is the lower triangular space. Yes, that is the lower triangular space. Tell me the boundaries. As you are talking about the lower triangular space, now the boundaries will be, see, it is this muscle which is the teres major superiorly, and this is the longer of triceps medially, and the shaft of the humerus laterally. So you are telling that this is lower triangular space. Yes, and the boundaries are superiorly teres major, and medially it is the longer of triceps. And what is laterally? Shaft of the humerus. And what are the structure inside? One artery and one nerve. So which artery and which nerve? The one which is running in the radial groove. And who is running in the radial groove? Radial nerve. And who is along with the radial nerve? Along with the radial nerve, you will see this is radial nerve in the radial groove. Along with that, there is a deep artery of the arm. What is deep artery of arm? Profunda brachial artery. It is called profunda brachial artery, deep artery of the arm. Oh, both of them are here in the lower triangular space. Yes. Let us look at this question, which is asking us about the accompanying artery with the axillary nerve in the quadrangular space. We have just seen the diagram, and you can immediately answer that it should be yes. As you see, it will be the posterior circumflex humeral artery along with the axillary nerve in the quadrangular space.